Hello, Melamed community, and welcome back to another episode of Don't Let That White Coat Fool You. I am Dr. Norma Mobley.
And I'm Dr. Dixon.
And we're so glad to have you here with us again. Please don't forget to like and subscribe. Our subscribers keep going up little by little, and we'd like for that to keep happening. And who knows, we might do another little dance for you.
Oh my goodness, that was so much fun. Listen, I think today we need to talk about maternal health again.
Again?
I mean, it just feels like we're never going to catch up to how we can impact this. And it's really concerning that in 2026, in America, we still have one of the highest maternal mortality rates in the countries that are supposed to be high-income countries.
Right.
So why are we there?
I think part of the reason is because our medical community at large fails to acknowledge that the problem actually exists.
Yeah, and if it's not that, they think that folks just aren't taking care of themselves, or folks aren't willing to take care of themselves. But the truth is that we still have problems with access to care, coordination of care, and really just believing women when they say something's not right.
Correct.
And especially Black women.
Mm-hmm.
So when we think about what we could be doing in America, we really know what to do. Those things. We have to make sure that women have access. We have to make sure that we are looking at whatever disease process might be going on in addition to their pregnancy that may be of concern.
Right, that could be causing complications. Also making sure that we ourselves as the patient are aware of what are those things that places us at higher risk.
Well, I'm telling you, with the way things are going with healthcare now, I suspect we're going to see more women losing their insurance.
Unfortunately. Which
impacts prenatal care.
Right.
We're going to see hospital shortages where if you're in an emergent situation, you might have to go further away.
Correct.
To get to a provider.
Because of hospital closures.
That's right. That's right. So all of those things are important to why we're still
And
here.
When you're talking about access to care, we gotta specify access to good quality care.
Absolutely.
Urgent care is not supposed to replace quality prenatal care.
Right. And for most women, that's the case. We go to our doctors, but still there are some conditions that we are more susceptible to as African American women, for sure. Preeclampsia, problems with our sugar, different things that may put us at even higher risk. And I think we pointed this out before, that when we talk about maternal health, we're not just talking about during the pregnancy, but before the pregnancy, during the pregnancy,
and after.
And how far?
At least 6 to 8 weeks after.
Well, that's what folks would think, but it's
even more, right?
A year.
A year.
Up to a year, you could experience a fatal outcome. So it's important that women are able to go to the doctor and keep up with what's happening with their health, and especially if they had a chronic illness during the pregnancy that needs to be managed beyond the pregnancy.
Their physical health and their emotional health.
So important. Many women experience some kind of mental issues after their pregnancy. And so we want to recognize that and not shame them for that.
Right, postpartum depression is real, and many people out there may not be aware, but your pediatrician can actually screen for those signs of postpartum depression when your baby goes in for their visit. Now, the problem can be if we identify a problem, then there may be an issue with where does mom go then to get that addressed.
Right, and that's important for us as those of you who are out there who are providers, like Norma and I are, that we make sure that we're taking care of our patients from the head to the toe.
Exactly.
We tend to cut off here at the neck and start doing all of this, but it's important that we have a good handle on where our patients are mentally and how to get them to the care that they need.
So talk about, you said before, during, and after. What are some of the before things before pregnancy?
It certainly is making a decision, right? When women make a decision to have a baby, they can prepare their bodies. They can begin to do things that would make them healthier during the pregnancy. So being able to have that forethought is so important to the outcomes that they want to have. So that's a great thing to plan your pregnancy.
Right.
Right? So if you didn't plan it, then get to the doctor right away so that prenatal care can happen appropriately.
Nutrition. Adequate nutrition is important, and right now, the way our economy is, that's been a challenge for a lot of people.
It has, and especially if we have some of our families who live in food deserts,
Right.
can't get to the right foods. But learning how how other things we can do, like our own gardens, can really help us to get to a good nutritious state.
Right.
Yeah. So I tell you, there's so much involved in us having our families be strong and healthy.
Right.
And we have to take ownership of that.
You know, I just thought about something else. I mentioned before about making sure that we as the patient are informed on what risk factors apply to us more. And that might have made some people think, well, does it have to do with your level of education or your socioeconomic status? Is that what places you at risk? But really, no. I mean, many of you out there right now in the general community, in our Melamed community, may be aware of a very famous tennis athlete who succumbed to a postpartum outcome that was very life-threatening.
That's right.
And she herself was unheard.
Right.
She knew about her body. She knew about her health. And she had to ultimately start coughing because no one paid attention to her. Her nursing staff, her physicians. She started coughing to the point where her C-section incision ruptured. And that's what allowed them to do the CT scan that found the emboli, the clots in her lungs.
Wow. So again, we keep bringing up the importance of advocating for yourself, right? And this certainly is a time when you have to do that. It's not that we don't have the science there to be able to take care of us, but the system.
It's the system.
The system is a problem. And so, we are trying to make sure that we inform you, that we give you tools that you can use to have better outcomes. And then we encourage you to seek out physicians who care about that for you.
And we also would like to encourage those of you who are pondering, well, what is it that I actually want to do in my life? What am I going to do when I grow up, if you will? Please consider medicine. If you are a person of color, please consider going into the sciences, STEM, and also consider medical school.
Yes, we need you. Medical school is not cheap, we know that, and there are some things we're going to have to do about that to make sure that those of you who are qualified can come on in to take care of your community. That is so important, even to this topic of who survives your pregnancy. Yeah. So we hope that this is giving you some information you can use. We want to make sure that everyone has a safe and wonderful outcome because we want families to grow up together and we want mom to be there.
We want moms to be there, absolutely.
All right, Melamed. See you soon.
Next time.